Welcome to Accreditation 101.
What is accreditation? Or accreditation? Accreditation?
Accreditation is a process we use to make sure the care and services we provide are as safe and high quality as possible, based on the latest health research.
Why do we do it?
The world of healthcare changes every day. New treatments, technologies, and discoveries happen all the time, leading to newer and safer ways of doing things. So, as a large, complex healthcare organization, we need a solid plan to fold these new updates into everything we do. This is where accreditation comes in. Most importantly, it's the right thing to do. If you or a loved one had to receive healthcare, wouldn't you want it to be the best? It helps show us what we're doing well and what we need to improve on. It shows the public that we're qualified and able to provide safe, high-quality care. It's also an important part of our quality improvement plan, helping us plug the latest research and guidelines into the care we provide.
Who does our accreditation?
An independent, non-profit group called Accreditation Canada. They also do accreditation for a number of other groups around the world, including EMS, correctional facilities, dentist offices, and medical labs.
Doesn't our quality department take care of accreditation?
While the quality staff help out a lot with accreditation, we are all involved in the process. We'll talk more about this later.
So how does this all work?
Accreditation Canada looks at the latest medical research, information, and guidelines and puts together a number of standards for quality and safety. Each of these standards has to do with one of 8 quality dimensions, like safety, work-life, or client-centered services. You can think of these as themes. Accreditation Canada groups these standards into about 30 standard sets and updates these over time. Each set has to do with a certain area or type of care, like mental health services, cancer care, inpatient care, and emergency departments. Some standard sets have to do with multiple areas or units, like infection control or medication management. Some of these standards are so important for safety or risk that they're given a special name, Required Organizational Practices, or ROPs. We have to meet every single ROP to get accredited. Usually, there are just over 30 ROPs in an accreditation cycle. These include things like washing your hands, making sure you identify the right patient before every test or procedure, and reporting all patient safety incidents. To simplify things, all ROPs are pulled into a single document so that we can make sure we're meeting all of them. Now that Accreditation Canada has put out the standards we need to follow, they'll be looking for evidence that we're actually following them. And they will use a few tools and techniques to do this. First, they give us a set of survey tools that we can use to see what we're doing well and where we need to focus on for improvements. The Patient Experience Survey goes out to a random sampling of our patients and clients, asking them how we did during their last visit with us. The Patient Safety Culture Survey is sent out to staff who provide direct patient care and helps measure the safety culture of our units and departments. The Self-Assessment Questionnaire is a voluntary staff survey, asking questions directly related to the standards. The Work-Life Pulse Survey goes out to all staff and helps give a snapshot of the experience and work environment of each unit and department. There's also a survey that goes to the board to see how things are going at the board level. For most of these survey tools, we have to have a certain number of responses to make sure the results are accurate, so it's really important that we fill them out when asked. Once each of these surveys are completed, teams and programs look at the results and make action plans to help fix the issues that were identified. Next, Accreditation Canada arranges a team of surveyors to walk through our sites and talk to our physicians, staff, and patients. This is called a site visit and usually happens every few years. Surveyors are staff, physicians, and patients from another Canadian healthcare organization who were specially trained by Accreditation Canada to do site visits. Before the site visit, the surveyors will go over the results of our survey tools, except for the self-assessment questionnaire. Those results are just for us. Part of the site visit involves surveyors following some of our patients and policies through our system, using a process called a tracer. During a tracer, surveyors will ask questions to the staff, physicians, and patients that they come across. These questions are related to the standards and help show the surveyors that we're meeting them.
Uh-oh. A surveyor might ask me a question about my job? Can they fire me?
No, it's not personal, and they can't fire you. Their job is to look at an organization, not how you work as an individual. They've been trained to help make people feel comfortable. Just relax and give your honest answers. To help staff see what a tracer might feel like, teams and programs do practice runs within their areas called mock tracers, where staff form a team and follow the same process that they use for their real tracers. This also helps us see where we need to improve and what we're doing well. Keep an eye out for a mock tracer near you.
Do we only have to do this every few years?
Accreditation is a continuous process going on all the time. It's more of a cycle. We're always at one stage of the cycle at any given time. While the site visit only happens every so often, we still need to be meeting all of the standards and ROPs so that our care is as safe and high quality as possible.
So what do I need to do for accreditation?
Accreditation doesn't have to be complicated. In fact, you're already doing accreditation when you do your job each day. Every time you wash your hands, do a tutorial on LMS, ask a patient for their identification, or double check a medication before you give it to a patient, you're already meeting a standard or ROP. You don't need to memorize the standards or have a script ready in case a surveyor asks you a question. So what can you do for accreditation? You can speak with your manager or supervisor about the ROPs and standards that apply to your job or work area. You can be sure to know where to find information when you need it. When you receive a survey, make sure you fill it out, giving your honest feedback. You can stay up to date with your training and education, including e-learning modules. And just keep doing the things you're doing already, like reporting incidents and washing your hands.
What if I have a question?
You can find all the current standard sets, ROPs, and other accreditation information on our intranet site. If you still have questions, speak with your manager or supervisor.